During the past year, hundreds of families reaped grief following the loss of their loved ones who succumbed to the virus, which has turned the world on its head and continues to wreak havoc across the globe. One such victim was 60-year-old Patricia Cummins, the country's 143rd COVID-19 fatality, who succumbed while a patient of the intensive care unit in November. Patricia was also the sister of Minister of Public Works Juan Egil. Still fighting to come to grips with the sudden loss of her mother is a 37-year-old Shondell Cummins, her two daughters, April and Angel Cummins, and the rest of the family. In an exclusive interview with Nightly News, a tearful Cummins reminisced that her mother was a significant component in her and her children's lives, and losing her is the most difficult hurdle she has ever had to face. On November 2, 2020, she took her mother to the Georgetown Public Hospital to conduct routine blood tests, after which she was told that her mother would have to be admitted to the hospital since the doctors had discovered something abnormal in her blood work.
They did the COVID test about 5 o'clock. They called me to say it was positive. They kept her and they had me in isolation, myself and children in isolation. And 14 days after she was admitted, I was told by my elder sister that Mommy is no more.
Cummins added that her mother, who was a diabetic, was on a ventilator for most of the 14 days she spent in the COVID-19 intensive care unit. Luckily, she added that none of the other family members who lived in the same house with Patricia were ever tested positive for the virus. She maintained, being an employee of the Georgetown Public Hospital, she took all the necessary precautionary measures to reduce the chances of carrying the virus home to her elderly mother. Cummins said that since her mother's demise, the family has not accessed counseling, which she hopes will be quick in coming to help them to cope. The woman's teenage granddaughters related how unbearable life has become without their granny.
I'm preparing for CXC in June, July, and she would normally motivate me to focus on my schoolwork, but since she left, I haven't been the same. When granny was alive, me and her would fight all the time. And she would tell me to do my schoolwork and all sorts of things. And since she's gone, I haven't been getting work or anything.
Cummins' message to those who still have doubts about COVID-19 is simple. It is real as day.
It is real. It takes lives. Wearing face masks, washing your hands, do what you have to do to protect yourself. And see how you can avoid being infected with the virus.
Meanwhile, 20-year-old Jevon Harris and his 5 siblings lost their father, 45-year-old James Harris, who was also living with diabetes, to COVID-19 on September 25, 2020. His elder son is now tasked with being the father figure to their younger siblings since their mother is also late.
If I had the chance to change one thing about Corona, I wish that it never did come.
Again, none of Harris's family members tested positive who resided with him. 1 year on from its index case, Guyana has made significant strides in several areas to respond to the potentially dreaded disease. Some of the areas highlighted by Health Minister Dr. Frank Anthony was the massive increase in the number of tests being conducted daily, the operationalization of the Infectious Diseases Hospital, which now houses intensive care patients, and the ongoing immunization of Guyanese. He opined that the quicker vaccines are procured and administered, the quicker the country can return to a full sense of normalcy.
And then once we meet that level of herd immunity, then we can actually bring an epidemiological end to the disease. But we have to keep working on immunization. And once we do that and immunize most of our population, I think we will be in a better position.
Additionally, there is need to continuously remind the populace about how the virus is transmitted and the importance of adhering to the precautionary measures. Exactly 1 year ago, the World Health Organization deemed the COVID-19 pandemic a public health crisis that will touch every sector. The health agency cautioned countries to establish a comprehensive strategy to prevent infections, save lives, and minimize impact. To date, there have been a total of 206 COVID-19 related deaths in the country. On March 11, 2020, health officials deemed Guyana's first COVID-19 case as an imported one. The deceased, Ratna Babulal, also suffered from underlying conditions before dying at the Georgetown Public Hospital. The 52-year-old female of Godope, East Coast Demerara, who had previously traveled from Queens, New York in the United States of America, visited the hospital on March 10 and presented herself with uncontrolled diabetes and hypertension. Subsequently, several of her family members were placed in institutional quarantine and eventually tested positive as well. Timeka Rodney reporting for the HGP Nightly News.